Hello, this is Dr. Marty Klein with more Sexual Intelligence. Today I want to talk about increasing someone's libido, whether yours or someone else's. Every week, people come to me for therapy with desire issues. Someone wants higher libido. Someone wants their partner to have a higher libido. Someone wants to know why all men are, apparently, a bunch of horny dogs. Someone wants to know why it's so hard to satisfy women. I usually ask a few questions, get a sense of who's in front of me, and then I frequently start a conversation about something else. Not something at random, of course. We don't waste time talking about the weather or a Miley Cyrus, but depending on the case, I often steer our dialogue to power dynamics, body image, self-esteem, conflict management, religion, alcohol or drugs, aging, health, chronic pain, menopause, contraception, or old wounds, the persons, their partners, or the couples. Libido can wait. Sex can wait. Sometimes the problem is fairly easy to spot. Some people need to drink less alcohol. Some people way less alcohol. Some people need to get a health checkup, especially regarding hormones, diabetes, hypertension, or weight. Some people need to explore possible side effects of their medications. If these fairly obvious things aren't a primary issue, we have to get into the more difficult stuff, personal and or relational issues. Whether your own or your partner's, what personal issues can inhibit sexual desire? Oh, let me count the ways. Anxiety, depression, poor body image, guilt, shame, and dreadful past experiences. Or the inability or unwillingness to let a partner know what you don't want, especially if they keep doing it and they don't realize you wish they wouldn't. If anyone expects sex to be physically or emotionally painful, that will most certainly limit their desire. Anyone complaining that their partner doesn't want sex very much needs to understand this. A bit of probing can reveal the specific ways that personal issues can undermine desire. For example, anxiety about body fluids, mistrust of arousal or orgasm, discomfort being seen naked, shame about sexual preferences, assuming that sex will be painful, resentment about non-sexual issues such as household chores, skepticism that a partner will be honest about their pleasure. These are just a few tangible ways that personal issues can undermine desire. In therapy, when we identify one or more such issues, we work on them in order to make room for desire. I'm always glad when we can resolve this fairly quickly, but sometimes it can take many, many months to do so. In some cases, even a year or two. Relational issues can make things even more complicated. Many people tell me their couple has a communication problem. Well, of course, everyone knows the solution to communication problems. You need to listen to me better. When two people believe this, their couple is going nowhere fast. In fact, if even one partner believes this, that's a significant obstacle. Such a limited concept of partnership must change if couples want to move forward, and that includes sexually. I'm fascinated by how many people expect that they or their partner will have plenty of sexual desire when their relationship is marked by conflict, insults, betrayal, criticism, power struggles, or pain. I know many people think this arrangement is simply called marriage. No. Let's look at history for a moment. Up until about 100, 125 years ago, most people didn't expect nearly as much from sex as we do now. For much of human history, most people expected sex to be occasional, short, and primarily for the man, or to create babies. Intimacy and female pleasure were either sideshows or no shows at all. For dozens of centuries, people have had that kind of perfunctory sex, disregarding a woman's pain or lack of real consent, the lack of privacy, the risk of disease, and so on. The most effective way women could opt out was by making sex or themselves unappealing. And if you had, say, 5, 6, 7 children, very common before 1900, well, you had babies around for 10 or 15 years, limiting desire and frequency. All the more so if you lived in a 2-room cabin or apartment. Well, now we expect so much from sex. intimacy, pleasure, variety, passion, self-expression, validation, proof of love. It's impossible to get those things from perfunctory sex, so actual desire has become more important. Given the structure of many relationships, desire is difficult to maintain, so some people go to a sex therapist. In addition to our biological apparatus, hormones, blood flow, etc., desire requires emotional apparatus, a sense of safety, the anticipation of cooperation, the ability to celebrate one's body, and so on. And desire requires that people expect to enjoy the sex at least some of the time. You know, when I tell people I don't like asparagus, they may be surprised. But when I say I don't eat it because I don't like it, nobody is surprised. Low desire for something you don't expect to enjoy is not a pathology. It's common sense. When people come in upset about their own or their partner's desire, I explain how complex desire is. Desire isn't simply driven by love or guaranteed by a partner's beauty or admirable character. It's the result of a complex symphony of biological, psychological, and relational factors. There's a certain amount of dumb luck involved too, what some people call chemistry. So after we rule out a few basic things like alcohol use and possible medical issues, anyone wanting to change their own or their partner's libido should expect an emotionally challenging examination of self and relationship. Now, you do that long enough with a highly skilled and experienced therapist, and you may find your or your partner's libido increase. And at that point, you'll find out whether low libido was actually the main problem or not. I'm Dr. Marty Klein. If you enjoyed this, do click like and subscribe. You can see about 100 more of these little videos on my YouTube channel. And for sexual intelligence, just one line at a time, check out my Instagram feed at Dr. Marty Klein. That's doctor all spelled out. Well, thanks for joining me. I'll see you next time.